and a lot of us battling the winter weather and also the sicknesses that come with it. Let's check in with Rose Belts this morning. She's making an early morning appearance. Good morning, Rose, and let's talk about the flu.
Good morning, Brianna. Thank you. Yes, and there is a lot to talk about indeed. So I brought on Dr. Monica German, who is board certified in pediatrics and integrative medicine, and we're going to talk about what parents need to know when treating their kids and teenagers, because sometimes they get left out. And Dr. Monica German was so kind to pass along some of the tips that she integrates into her practice. We're going to talk about the 2 V's, the 2 D's, and guidelines. So Dr. Monica, go right ahead.
So the first V is the vaccine.
Right.
The vaccine should be strongly considered. It offers at least 30% efficiency. So some protection is better than no protection.
And so what about people who did, especially for children, if you did not get your child vaccinated yet, is there still time?
Yes, there is still time. It takes 2 weeks to develop immunity, so it's better to do it earlier than later.
But if we do, it's okay.
If
you do it.
We still have 2 months of winter, so I think we'll still see a lot of flu around.
And let's go on to the antiviral therapy, which I think is really important, and the difference between the age groups.
So the antiviral therapy can be started even after 2 weeks of age. So if you have a young child, you do want to start that as soon as possible.
So if they do get the flu, it's okay to start them on antiviral therapy.
If you get the flu, it really depends on the age and the high risk. So if you have a child who is high risk, who has asthma, who's very young, then you definitely want to call the doctor and see if you should be seen. If you are a candidate for the medication, you want to be seen within the first 48 hours.
Gotcha. Now, to prevent that, before we even get to that point, you talked about vitamin D3. I thought that was really interesting, and diet.
Yeah, so vitamin D3, there are studies that show that it's very efficient in preventing influenza. So I would definitely consider adding vitamin D3 to the vaccine.
I thought that was interesting. Is there a vitamin D that you recommend? I think it can get a little confusing for parents when it comes to choosing a vitamin D.
So I recommend vitamin D3, not vitamin D2. Vitamin D3 seems to work better.
Okay. That's interesting. Mm-hmm. We'll talk more about that on the Facebook Live for sure, and a little bit about diet and why that's important in children and teens.
So diet is very important, as it is a very strong, it helps boost the immune system. So getting the sugar out, getting the processed foods, increasing the color in your diet. We want that rainbow diet with a lot of vegetables, a lot of fruit, and cut back the sugar and the processed food. That will increase the immune system, will make it stronger, and will help with dealing with the disease and also responding better to the vaccine.
Great. And real quick, for sake of time, let's just talk about the guidelines real quickly before we toss the break into Facebook.
So the guidelines, I think it's very important to react early. So if you think your child is getting sick, don't send him to school. Keep him home. Make sure that she or he gets enough rest, get enough sleep, and hydration.
Great. Well, thank you, Dr. Monica. Okay, we will be back with more KREM 2 News, and those of you who want more information from Dr. German, feel free to tune into Facebook. We're going to go a little bit deeper about some of the things that we talked about today. Thanks so much.